I'm in California. I have 4 kids. They all have medical issues, and finding tools and modalities to help them through those medical issues has been monumental in so many ways for them. But tonight I'm just going to talk about 2 of my kids. Both of my daughters, one is 16 and the other will be 11 in November, were both diagnosed with cardiomyopathy just over a year ago. Cardiomyopathy is a disease of the heart, which basically means it's a low functioning output of blood from the heart. So I wrote down some numbers so that I didn't get it mixed up because I'm not a medical doctor.
Yes,
and I only know from my research of what the heart should be doing. It's the ejection fraction numbers that they look at to diagnose the cardiomyopathy. And a low functioning rate is between 40 and 55%. That's considered low functioning for cardiomyopathy. Possible heart failure is below 40%, and a normal range, which is the target that we want to be in between, is 55 to 70%. Okay, so last year, my oldest daughter, which was diagnosed with cardiomyopathy, was actually the more severe of the 2. It was affecting both sides of her heart, and her functioning rate was at 46% last year. Wow. So that is in the low functioning range. My third daughter, Myopathy, she was measuring at 51%, which is a little better than her sister, but still in the low functioning percentile where we were concerned. So a little backstory about Myopathy. She's also a cancer survivor. She just celebrated her 4-year cancer-free journey in September. So these medical issues are no stranger to our family. So kind of the modalities that I've used just from inception is, okay, we're going to treat it medically, but what else can we do holistically to support their bodies? I'm a firm believer that God kind of puts tools in our path that we need, that we don't even know we need yet. So about, let's see, I was introduced to LifeWave back in June. So it would have been about 3 months prior to my daughter's diagnosis with cardiomyopathy that I was introduced into the patches. And so when they got this diagnosis, I was hopeful because I had a new tool to use. And I immediately started patching my kids with the X39 and the carnosine because we know that that supports healthy heart functions. And I just, said, what can it hurt, right? I mean, it's totally not going to invade their body with anything. It's not going to give them any toxic overload. It's just going to support their bodies to do what it's meant to do. So I started patching them about a year ago, and they just had their 1-year follow-up with the sonographer on Tuesday of this week. And McKinsey's rate went from 46% to 60%.
Wow.
And my Leah's went from 51% to 64%. So now both of my daughters are within normal ejection fraction range, which is considered 55 to 70. My oldest went from 46% to 60. My Leah went from 51 to 64. And now they both are within normal range for cardiomyopathy. So technically, they no longer fit the diagnosis rate of having cardiomyopathy in just 1 year of using X39 and carnosine.
Wow.
So I am just so grateful and thankful for this technology that was put into our path in perfect timing. And both of my girls are healthy and their hearts are doing great. And I just am so excited to share this with everybody to give them another tool in their pocket to use if they're facing any kind of medical issues. These are great patches to support your body to do what they're designed to do, which is to kick on those stem cells, right? And to do that repair that our body needs. So I just wanted to share my testimony about that.